Welcome to the Nobody Told Me That podcast. My name is Teresa Duncan, and my goal is to share information that you probably weren't thinking about. I love preparing my friends for situations that may come completely out of the blue. I also want to share with you many of the tidbits I picked up over the years. If you absolutely have to tune out before the end of the show, make sure to check out the show notes for more details on today's topics and information about my online class, Dental Insurance Design and Management. And thank you so much for making me a part of your day. I'd like to give a shout out to my friends at Synergy Dental Partners for sponsoring our podcast. They know how important the admin team is to our industry. Synergy is a group purchasing organization, or GPO. GPOs reduce your overhead with lower supply costs. They also have partnerships with labs and various service providers. You owe it to your revenue cycle to check them out. They're giving Nobody Told Me That listeners a 2-month free trial and a $200 Darby credit for new Darby customers. For more information, check out the link in the show notes or go to odysseymgmt.com/synergy. And we are back with another edition of Nobody Told Me That, and we're going a little virtual like we already are, as you know, but we're going to go a little bit virtual with somebody that I see on the show floor quite often. I have Brant Herman here with me. You might know Brant from Mouthwatch, but he's got this really cool, interesting venture that I wanted to talk about and maybe put a little bug in your ear. Brant, how the heck are you?
Oh, I'm doing great. It's great to see you again.
Yep, same here. So you created this camera that everybody went kind of crazy for because it's pretty cool, right? So Mouthwatch, I know a lot of the clinicians are going to be very familiar with that name. You've won a couple different awards like Dental Town loves you and the Nifty Dentists love you and all that. So that was your kind of start in dentistry, or was there more to it? I don't know your backstory before Mouthwatch, actually.
Yeah, so my introduction to dentistry was as the kid of a dentist. My stepmom's a dentist. My dad's a dentist. So I grew up cleaning instruments in the back room. That was the summer hustle. And yeah, then started some other companies and came back around to dental after exiting my last company about 14 years ago now. Mm-hmm. And that's where the original idea for the intraoral camera and really the power and impact of images. And we had tied it to an initial platform, which was kind of early Teledent, which was our teledentistry software.
Yeah.
Of trying to engage patients when they're not in the office, but doing that through imaging and video consults.
And when COVID hit, you guys probably were like, wait, what happened here? You were super busy. All of a sudden, people were very interested in this teledentistry. And I know, I got calls about it, how do you bill it? How do you bill it? So I thought, geez, if I'm getting a million calls about the coding, the actual teledentistry people must be drowning. Yeah. How was that period of time for you?
It was nice. We joke that we never put a pandemic in our business plan, but it definitely helped shift where we saw a lot of success in teledentistry being hygienists going out into communities and serving patients in schools or nursing homes or in mobile programs, and really making a faster understanding for conversations we had for years, which was a lot of head scratching of how does this even, help my practice? But yeah, we were signing up so many practices a day and really helping them connect to some revenue during that period of time of offering evaluations and triaging patients and seeing which ones they needed to see. The biggest lasting impact, which I really appreciate, was just one kind of broader adoption and acceptance of virtual care and how that can really be helpful for patients across the board, and really just kind of common sense policy of insurance companies understanding the value and reimbursing for it. And also state by state policies change significantly. And we haven't seen really anything lasting rollback following the public health emergency. So it's been good. It really opened the door to, I think, teledentistry being a lasting kind of tool in the tool belt of delivering care to patients.
It was kind of a slow, plodding along of the acceptance of virtual care. Because I remember talking to you over and over again at these meetings, and you were going along there, and all of a sudden, Like it seemed like where did all these people come from? And I was like, wait, we've kind of been there, but okay, all these people came out, and there were a couple companies that were there along with you. But I do appreciate that one aspect, that simple one, not very many other parts of the pandemic, that it did really open our eyes about how differently we can do business. I mean, our just on the admin side, we now are talking about, outsourcing a lot more, simply because so many people wanted to stay home. So
Right.
everything's changed. I'm sure these poor dentists are going, wait a second, I don't have the option to do that.
Right.
So
Exactly.
so what did your family think when you first said, okay, I've got this camera idea? What was that conversation like at the Thanksgiving table?
So I was helping out with my dad's practice in just doing some rebranding and updating some marketing and adding some technology. And that's where we saw the patient who was dressed to the nines and really spent a lot of energy on her appearance, but saw an intraoral camera behind her lower anteriors and just flipped out. And so from that scream of, like, if I saw this in the mirror, I would definitely act on this,
Mm,
to I can only understand this when I come to the dental office. So they got it. I mean, I think it was an interesting journey for us because the teledentistry part was a little bit too early for the practice that I grew up knowing, of kind of a fee for service, traditional private practice.
okay.
But we saw our platform on the software side being used and kind of rejigged by public health programs, hygiene supervision programs, where it might be an FQHC that's sending people out to a community setting or a
Mhm.
school. They were using our software. And then on the camera side, which we were trying to sell bundles of the camera and the software to most practices, the dentists were like, forget the software. I just want the camera. Like, this is
Right.
a great price and a great camera.
Yeah.
So that's where we kind of said, look, these are two different things. One is the SaaS approach to really giving practices a teledentistry tool
And that's
where it makes,
software as a service.
yeah,
Just want
software
to
as a
make sure
service.
we get the acronyms out.
Right. So that we have those programs where they're typically seeing a different type of patient profile or a different business model.
Mhm.
And then cameras just help every care provider show a patient what they need, help them understand, help support insurance claims and reduce denials. So that's where our camera was really the right price point. It integrated so easily. So we saw more and more practices utilizing and adopting the camera chair side.
Mhm.
And then what was great is because we had this footprint in telehealth, we also started seeing a lot on the medical dental side where, oh, now a nursing program or a home healthcare worker or a nursing home, they can have the camera to document dental issues and then start sharing it to a practice if that practice is accepting kind of patient consults from those different settings.
So the whole access to care, when you talk about it in that way, and we'll talk about how Dentistry.one just kind of came out of that. The whole access to care thing has been, I call it this thing just because we've been talking about it so often, but the ADA has really pushed that, as has Center for Medicare and Medicaid Services. But just talking to dentists, on the show floor, in conventions, access to care is something they care about, but it's not the number one thing. And so I feel like there's always been a disconnect between what the lobbyists are wanting to push through versus what the dentists on the ground. But that's not to say that they don't care about it, because what I hear often is, I want to do more. I want to get out there and I want to help, but how do I do that without putting my office at risk? And we'll talk about that. But you mentioned FQHC. I just want to make sure the acronyms are out there: the Federally Qualified Health Centers. And I was exposed to that because I did some trainings for them, and it was mostly the Indian Health Services that I
Mm-hmm.
was doing the training for. And that's a whole different way of doing business. A lot of times they'll come once and to get something taken care of. So you got like one shot
Right.
at that person. And it's very similar to urban settings with Medicaid and other public health settings. So what was the big wake up call where you were like, okay, we have this access to care that we could potentially solve, but Mouthwatch doesn't quite work. So
Yeah.
now what do we do?
Yeah. So I think, and it's important as we get into it, to me, access to care sometimes looks like just a full schedule for a private practice doctor, right?
Okay.
It's about how do we make getting into a dental office easier and more convenient, regardless of what kind of coverage I have or what kind of practice I am, is we want people to have an easier touch point to dental expertise and then kind of all of the steps that get them into physical care. A big differentiator from us in the let's say in the teledentistry world versus the telemedicine world is we can't do just telemedicine mental health. That's an entire medical appointment that never needs a brick and mortar visit. We can do a lot with general medicine where I'm calling in the prescription. If that doesn't resolve it, then you need to come in. But a lot of times in teledentistry, we've got to get you into a chair. We know that sometimes you don't have to. Sometimes we can help you resolve it through home care, or maybe it's a prescription that, can shift it. We also know that 30% of what people think are emergencies are not emergencies, and they don't require an in-office appointment. So I think to your point, what for us really opened the eyes was that we were positioning and putting Teledent, which was our teledentistry software, in front of a wide range of practices, from individual practices to specialty practices to DSOs and public health oriented programs like a federally qualified health center or a community health clinic, or mobile programs that were seeing patients in different community sites. And we loved that they got it. And when it worked for them, it really worked for them, and it made them more efficient. So now one dentist could supervise 5 hygienists and see what they were doing, authorize services to make that a really profitable and sustainable model of delivering care in the community. We also saw that there were these challenges that a traditional practice really couldn't embrace. That, yes, it's a nice convenience for their patients to be able to talk to them after hours, maybe do a case presentation when they're at home with their partner and they don't want to sit in a dental chair and feel like, cool, now I'm being talked to about all of this care I need. Let me think about it. Let me have someone else to ask questions. So there are ways that practices were using teledentistry, but we saw that in some cases that traditional model of care was the biggest obstacle to really having teledentistry see its bigger value. So that's where we saw Dentistry.one was what we wanted to do, where we would form a DSO, but it's a virtual only DSO. So we have that structure, and then we could go work with, instead of really just individual practices or like an FQ, we could go to an insurance plan or to an employer and say, look, we're going to be this add-on benefit, or we can even accept your existing dental benefit and be the virtual layer that helps patients understand their dental need, connect to a dentist more easily. And a big differentiator for us was we didn't want to just say, cool, Teresa, you have a dental concern. We're going to have a virtual consult and just confirm that you have a dental concern. To us, that felt frustrating.
Yeah.
So a big difference for us was closing the loop. So we have care coordination as a part of that. And we're going to make sure that if you talk to a dentist and you need treatment, we're going to help you, that patient, book the appointment with a local in-network dentist to get them the care that they need. So we know that there's a limit to virtual, but what we want to do is just make it more accessible to anyone, no matter where they might be, whether it's busy in the city or rural and far from a dentist. We want to help you understand what you might need, and then make sure that we're helping book that appointment to get you into an office where you can get treatment.
Okay, so this is where when we were doing the pregame, this is where I needed clarification, because when you say DSO, my first instinct is, okay, now Brant's going to come and gobble up my practice. Okay, what's going on here? So that's not the case. So let's put a pin in that. So when you say DSO, it's not traditional like accumulating DSO. Okay, so there's that. Then there was the piece, because as I'm reading the website, I was thinking, wait, I have to participate? Wait a second. This is Medicaid. Wait a second. So that's why when you got on, I was like, I have all these questions. So I just want to make sure we throw that out there so that people continue to consider this, because I think it actually gives a lot of options for dentists that maybe had ruled this out because of their existing practice structure.
Right.
So it's not a gobbly DSO. You had to form it because you needed an entity in every state. So that's what needed to be done. That's why you call yourself a DSO, a virtual DSO.
Yeah. So in order for clinical care to be delivered to a patient, there's only a few states where a corporate entity can own a business that employs dentists.
Mm-hmm.
So we have relationships with PCs, professional corporations in each state, and that's the relationship with the provider. So we have a practice owner who can communicate with those providers and make sure the quality standards and all of that is treated as a clinical entity. And then what Dentistry.one does is we provide that support service, right? A dental support organization where we can help them with the billing for their practice, with malpractice coverage for all of the dentists that are enrolled under Dentistry.one, with the platform and our software platform that helps bring patients to the providers. So we kind of bring this layer of the marketing of the virtual service, the presence of Dentistry.one as a brand that can form relationships with insurance companies or employers, and then say, no matter what state you have an employee in or a member in, we have the ability to legally and effectively deliver virtual care to that. And what's nice, I know a point you brought up. So one, we're not looking to acquire any practices. We want to just be the practice. And then when a dentist wants to have a side hustle, or maybe they're working clinically 3 days a week and they want to work from home a couple of days a week, that's where they can affiliate with us. So they become a dentist in our local PC, or if they have 5 states where they're licensed, they become affiliated with the 5 states where their licenses are active.
Yeah.
And if we have a patient in Iowa, cool, we'll route that patient to that dentist. And if they're also licensed in California, a California patient can come to them. So no matter where that dentist is physically located, we're able to kind of bring patients for consults as long as they're licensed in the state where the patient is coming in from.
Okay, so I know my insurance people, first thing they thought is, well, if I sign up and be part of this program, so just talking to my insurance administrators here, so I'm going to sign my doctor up to be a part of Dentistry.one. We're going to see some Medicaid patients. Wait a second, does that impact my existing networks, my existing participation? Because that is probably right now in the insurance world, that is the number one pain point that we have, is the networks have gone wild. Right. Nobody knows what network they're in. And it just seems to be getting worse. That's the kind of sound from the street. Yeah. And so that was one of the first questions is, wait a second, does that impact? And you said no, because they're acting under the Dentistry.one license, malpractice policy, and all of that. So if they're doing work for you, that doesn't even impact their practice. Even if they're doing it in their practice, it doesn't matter. Like, do you see what I mean?
If they're participating with Dentistry.one and they're affiliated with one of our PCs, we can enroll that PC in a state Medicaid plan or commercial plans that they may not want to accept. In their private practice, their fee for service, you come in, pay cash, and then you deal with the claims separately. They're out of network. Yeah. With us, they would be able to be in network, and it's only for the consults and services that are billable through the Dentistry.one relationship. Mm-hmm. So it's nice in that, and back to the access to care part, that's where we say, doctor, you have a great thriving practice 4 days a week and you love working in that setting. If you would like after hours to maybe do some evaluations, we'll pay you for that. We'll contract you at a rate, but then we're going to bill Medicaid or whatever commercial plan that patient has. Mm-hmm. And then because we're contracting you at a rate, we're able to make sure that they're able to see more of those patients. We're reimbursed for the services that they provide, right? The PC is reimbursed, and then we're able to pay that dentist kind of a flat rate that they're whole on and they've accepted and they're happy to get.
So what I love about this is that this is what the dentists tell me, and I'm sure they tell you too. Like, I want to give back to the community, but I need to do it on my terms because, if I know that people don't want to necessarily sign up with the state programs because they feel like that's going to overtake their
Right.
own practice. And this is a perfect solution for that. I know so many dentists who are selling their practice or they're winding down or perhaps even dealing with disability.
Right.
This is perfect for them. I mean, I don't see any, I mean, honestly, if you're a dentist selling the practice and you're kind of winding down, what's better than sitting in your office? You go do some hygiene checks back and forth and you take a call whenever you get one routed to you. Like, what a nice way to kind of wind down the career.
Yeah. Yeah, and it's nice, and you can have this kind of broader impact, and that's where we still are in the game of connecting that patient to care. So
Mm-hmm.
some of those challenges of finding the physical practice that does accept, we'll take that on, and we can't change the world all in one fell swoop, but we can at least help mitigate that urgent need for the patient and as much as we can. And the interesting part, like what is frankly more upsetting than I would want it to be, is just the amount of time. So you're looking at over 20 days as the average wait time for a patient on good coverage to
Yeah.
get into an office.
Yeah.
For a kid on Medicaid, it's 60 plus days to get in.
Oh, wow.
So some of these things we can do of, you need a dentist, we will talk to you immediately. You can talk to one of our dentists. We'll help you understand what the urgency, what it might be. We want to shift some of those visits to emergency departments, which are very expensive, and 2% of all emergency department admissions are dental issues.
That's so
We know
sad.
that we can kind of change the game a little bit on that and
Mm-hmm.
keep some of those patients out of a very costly to insurance companies ED visit,
Yeah.
and also find these other ways to say, look, we're going to give you the immediate access, help you understand the need. And some of what we've seen in the conversations on plan side is that if we're helping them triage the urgency and the scale of that case, then they might be willing with some of their network to say, can you hold some slots for true emergencies that we want to get in because they've been vetted and triaged already, and you're not going to kind of hold time for someone who's not going to come in, or it may not be as urgent as you thought. So it's kind of multiple paths to, I think, really improving everyone's access to care in a way that's not pigeonholed into public health and just access to care on the public health side. We think this is a great way for a commercial plan, an employee who's in their 30s and pretty healthy, but just wants an easier experience that doesn't always have to take place in a dental office.
Mm-hmm.
It can be really supportive of overall health and just make that whole process so much more convenient than the 2 days a year where you're going in for a 6-month preventive visit. We still think you need that, but what if I have a question or I had a concern, and it then needs to get me into an office, but we need some resolution.
So you went to the National Association of Dental Plans, and you were at the meet. Was it your first time going to that meeting with Dentistry.one last year?
With Dentistry.one last year, and then we'll be back this year.
So insurance companies aren't known, and lots of love to the people I know in insurance companies, but they're not known for pivoting, and they're not known for making fast decisions because you've got this team of bean counters hidden behind doors that have to make sure the numbers mesh. How are those conversations? I mean, you've got just a limited amount of time as an exhibitor. I mean, how is that? Or do you feel like you're still like it's a marathon type thing? How's that?
Well, I think with a lot of the commercial plans, they recognize, and I think the pandemic brought that immediate need where their customers, employers and employer groups, are saying our members want and our employees want a virtual care option. Mm-hmm. Now, what I like is we're in a spot of differentiation of that, not just checking a box, but we are seeing commercial plans. Look, and if a commercial plan can sell more plans and improve the product offering by incorporating something consumers are asking for, then I think we're in a great spot. And it's not that we're suddenly going to use up all of these codes and hit them at a higher cost. I think we're actually engaging patients earlier for a preventive approach and hopefully mitigating something that gets postponed and becomes a much costlier claim. and at the same time adding this really cool technology and virtual ability for members to say,
Yeah.
you know what, I did have a question about that. Let me actually find out what it is before it becomes a much more costly thing. So it's been nice. I mean, I think within commercial dental plans, they're driven by, I think, market differentiation and adding value to their members. And I think we can really do that in a way that modernizes plans. You know, we're also hearing a lot with dental loss ratio of how are we going to offer services that, you know, bring more care to members and do that really effectively and cost efficiently. I
Yeah.
think that's where virtual care can help that. And we have other services. We're doing a lot with salivary diagnostics and coaching and almost acting as this kind of oral health wellness and concierge service.
Okay.
Um,
Okay.
so that's exciting to kind of, we have a staff of hygienists who you may not always need to talk to a dentist. I kind of say in that typical preventive visit in a dental office, it's a really jam filled where the patient can't talk most of it.
I
Their
know,
mouth is
right?
open. They're getting all of the great services that hygiene provides. And then that time at the end is really like, okay, I got to go on to the next patient. So we're trying to bring a level through coaching of, I had questions. What product should I be using? Is my
Yeah.
technique right? I'm not flossing enough. What could you recommend that would help me? So that's where we want to bring kind of coaching services in, that we're helping engage patients in a way that traditional practices are limited in the time frame with their patient to do that. But we
Mhm.
might be able to complement that and help them kind of see their own habits, and through engagement in a way that's convenient to the patient, messaging or a video consult with a coach
Yeah.
of, oh, I have improved my oral health care. So hopefully the next time they go back, there's less bleeding, there's a reduction in gingivitis and periodontal disease. And we're kind of moving the needle on all these things that we know are,
Mhm.
you know, really at epidemic levels, but want to be improved upon by patients. Just how do we make it more convenient for them to do it?
Well, speaking of that, one thing that came up, I'm a part of. I'm lucky enough to be a part of some good masterminds, and in one of them, the question was brought up about oral surgeons wanting to um, take advantage of teledentistry and not necessarily seeing the referrals right away. And shout out to my friend Kate Reed, who really specializes in the oral surgery world. But what she was sharing is that, most of the time when a patient is sent over to the oral surgeons, it's the same thing. Like if it's wisdom teeth, it's the same thing. They don't necessarily need to see them. Like you could probably just peel it back, look at the pano, look at this, whatever images are sent over. And she said she has oral surgeons that would prefer to do that virtually because it's kind of, I mean, I hate to say, but it's kind of a waste of having them come in. So
Mm-hmm.
then they can answer questions. The parents are right there. And if it's a child, obviously. So I thought, well, gosh, we've really changed, because I remember pushing back a little bit with ortho, where you could do the teledentistry check to deliver the next clear aligner set. And
Yeah.
that I had to wrap my head around, but makes sense. And now you're telling me before wisdom teeth, not you specifically, but Kay's,
Right.
like before a wisdom tooth removal, we don't really need to see them. Is that another use case? Are you seeing that increasing? Are there other surprising use cases for that?
Yeah, I think it's interesting where, that look-see appointment, and that's, where it is great coming from that dental background and knowing just firsthand of, yeah, I'm really just quick, like everything's fine.
Yeah.
So we
Right.
know in a lot of cases, clinicians are doing a lot of services, and we see this more on, let's say, rural or distance, where
Sure.
if I'm doing an evaluation and assessment, and then I'm doing a procedure, and then I'm doing a follow-up, and this person lives an hour away from my office, that's a lot of time that we could, like your colleague says, one, we pretty much know what we're going to do when you come in, right? So maybe I have to add 10 minutes onto the procedure because I haven't physically evaluated you, but I have all of your clinical records and imaging prior. And
Mm-hmm.
then if I could shift the post-op to a virtual, I've now saved 2 hours of op time,
For sure.
right? So as we're looking at practices, trying to figure out, one, I might be short staffed, I have higher costs in my office. What can I do to make my practice more efficient and see more patients for higher value services or things that, you know, are chair time worthy.
Yeah.
Right.
Yeah.
And also increase the level of service to my patients, where my patient would love to not drive an hour in and an hour back.
Mm-hmm.
And even if I'm in Midtown Manhattan or downtown LA, it is still a lot of time for me to leave my office, go into the appointment, wait in the appointment,
Yes.
be seen, and then come back. So that's where I think, you know, I love that access to care, because to me, access is just how convenient is it for me?
Mm-hmm.
Whether I'm rural, whether I'm downtown, no matter my socioeconomic level, if it's convenient, I'm going to have an easier path to actually getting the care that I need. So, yeah, I think we see practices deploying that a lot. We have seen more, and we're really excited by, you know, that's where our cameras and teledent, and we're seeing more with Dentistry.one of on the medical dental side of, can we turn a medical touch point into a dental screening touch point? Where we know a kid is going in for a well visit. If they have a dental concern, let's not just give mom a card that says you should go see a dentist. Let's actually document it. And that's what's great, where now Dentistry.one can be the dentist for that kid during a pediatrician visit or for an emergency department visit, where the dental appointment happens, even though it's virtual, it happens immediately. And then we kind of help shepherd and do that next level of saying, we're going to get you into an office, but we know that this took place. And we're really excited when we look at innovative plans and programs where they might say, we know we have a diabetic population. We know that their oral health is compromised, and we can save money on the diabetic spend by engaging them in preventive dental care more effectively.
Yeah.
Or we know for pregnant members, we know for cardiovascular health members, or for chronic, you know, inflammatory disease. All of these patients benefit, and there's a cost savings and outcome improvement when they're connected to oral health care. But the silos of medical and dental, as much as there's some touch points that are happening, we really think like a digital bridge helps make that medical encounter more easily connected to dental, and then will help make sure that patient gets into the physical office and the dental care that they need.
Just a reminder to check out the companies who support the show. My friends at Synergy Dental Partners are offering 2 free months to try out their lower prices for labs, supplies, and select software services. To sign up, visit odysseymgmt.com/synergy, and the link is also in the show notes. So I love that example about the pediatrics, bringing the kid in. Christine Taxon, who's been teaching medical billing for years, you know, Christine. And if you don't know, if you're thinking, do I know Christine? You don't know Christine, because if you've met Christine, you absolutely know. She's like such a powerhouse, just so much energy. Brant's laughing because he knows, like, you always know Christine. Christine's from New York and you just know her. But I digress. What she has always said to me, I mean, for the last couple of years, she said dentistry needs to wake up because the pediatricians are going to start doing dental stuff, and they don't need them unless they make themselves available to come to the table. And I've been seeing that last year, especially having conversations with some of my own medical healthcare providers. So you're telling me that if a pediatric office spots something oral, instead of, like you said, just saying go to your dentist, and first of all, many of them don't have dentists yet. Maybe this is something, a young child, they're like, I don't even know what I'm supposed to take them.
Right.
So to alleviate that, she has spoken with some medical health systems who are hiring either hygienists, or they're teaching the dentist, they're giving the dentist crash courses on oral health. Not the dentist, the physicians. And so I don't like that, because it feels like we're kind of ceding that back, like we're giving that back to the medical side. We don't, like, why are we doing that?
Mm-hmm.
But if you have a solution that keeps us from doing that, and we are in the office with them, I mean, that's a beautiful thing. And do you feel like that's a possibility, that the medical side will just kind of go, yeah, we need to look at that, and if dentists aren't around, they're not around?
I do think, there are CPT codes now for fluoride varnish and silver diamine fluoride. So in some cases, I think more on maybe the Medicaid side, that's happening. Mm-hmm. But I love it. We've got a program in Massachusetts now where there's table tents with a Dentistry.one information and a QR code. So as soon as the dentist or the pediatrician sees an issue, or a general physician, you have inflammation in your gums, I can't treat that, right? But you've told me there's pain. They scan the QR code, they schedule a live consult with our dentist, or they schedule it for tomorrow, whenever it's convenient for them.
Yeah.
And now they've got the dental consultation that happens to a much deeper level of knowledge than a pediatrician has, right? Or a general physician. And then we're able to help that member, and then we can get them into treatment if they need it, or if we can just help resolve it. Another cool part on the pediatrician side is there's a higher rate of well visits for kids than there is for pediatric dental visits.
For sure.
So we also know a lot of this is how do we incorporate it into, let's say, the prenatal care of a pregnant mom. And then when the baby's born, that's an earlier visit, and a lot of things that we could do with mom in terms of education and helping them understand what to do. Don't put them to bed with a bottle. Watch out for like things that are oral hygiene instruction and just nutritional counseling. We can do much more readily that a mom would do that on her phone. She may not come into a dental office to do it.
Yeah.
But we could help them. And then you start changing kind of trends of, oh, there was a lot more parental education earlier. Yeah. This kid now has fewer cavities. They're missing less school. They're healthier overall. They're going to have kind of a lifetime of better oral health because it started with mom knowing a little bit more earlier and having those conversations with the dentist. We also love it. And we've got integrations coming into Epic and Athena Health and some medical EHRs where we want to trigger as soon as we see someone diagnosed with diabetes, or as soon as we see someone diagnosed with a relevant systemic health condition, we can engage that patient directly because they're probably leaving that doctor's office with a bunch of materials about all of these lifestyle changes.
For sure. Yeah.
And then we want to just make it as easy as possible to say, hey, your outcomes with diabetes improve when you get regular dental care. Talk to a dentist and we'll help get you into a local practice. So all of these ways that we can really kind of bridge medical and dental within the existing structures that there are, just using a little bit of technology to kind of help bridge that and using the virtual consult as a tool in it.
You know, another, I'm just kind of, just popped into my head because I've in the past worked in conjunction with some fertility centers through dental offices because there's not a direct link, but there's enough, of the correlation or whatever, that it's not causation, it's correlation. I have to keep that straight, between periodontal health and the ability to conceive, but not just that, but having low birth weight babies.
Yeah.
So there's a lot of studies and research about that. And I know one fertility center I was familiar with, they actively would, if they had periodontal disease, they needed to go get a check. Yeah. Like they would not start this $40,000, $50,000, $60,000 treatment unless their mouths were healthy, because that was a risk they weren't comfortable with. And that was, we would see women trying to get pregnant coming in saying, I need, and they didn't even care about insurance paying for it because they were like, I need to get healthy. It's about 6 months for me to get healthier. Like they need to get started. And, speaking as a former woman who wanted to get pregnant, there's nothing crazier than a woman that wants to get pregnant. And that's like the path, like you show me the path and I'm there. Right.
Yeah.
So that was actually a really interesting, when I was going down that road, I was like, wow, that's a whole new way for dentists to reach a market they didn't even think about. Like I'm thinking, your QR code in a fertility center might make a huge difference too.
Yeah, we see it. Everyone's had personal experience with someone going through chemo or radiation therapy.
Sure, yeah.
That's a place of, you got to evaluate your soft tissue before you go in. Cool. Now I'm on my own as the patient. So that's what we really want to do. And within a health system, they're really good at referrals and navigation between the oncologist and the radiologist, or all of those steps, or the endocrinologist and your GP. Once you get into dental, it kind of lives outside of that. So that's where we want to say, if you're going in for cancer therapies, we can help make sure that happens. If you need a joint replacement, they want to evaluate, they want you to get a dental evaluation. But right now it's more like, hey, this is on you to go get taken care of and then come back. So we're trying to help bridge all of those places where yeah, I can't do periodontal therapy on a virtual consult,
Of
but I
course,
can
yeah.
help you evaluate it. And then we're going to make sure you get into that office and do a lot of the things to keep you engaged in that journey. So hopefully it's not just, I did it one time because I needed to get a okay. I'm
Yeah.
going to keep engaging and, make sure kind of my oral health is ongoing and improving.
So this is, I mean, this is really exciting. So listeners, what I want you to do is, take a look at, first of all, wrap your head around the concept, take a look at the website, but you all go to medical offices, you all go to get your blood pressure checked. Talk to your doctor about this because it's going to take not just Brant and his team reaching out and people doing the same thing, but it's got to be the dental community reaching out and saying, "Hey, we want to partner with you on this." And for my colleagues who are not the dentists, we're the admin team. We also, I mean, we can't shut up about things. We need to do the same thing when we go to our offices and talk about this. I think actually this could really move the needle a lot. I'm excited about it. Now, you're also working with a friend of mine, Dr. Quan Watson. He's got the Care Mobile clinics, and that's something that before COVID kind of limping along, hadn't really, so this is a perfect fit too. Can you talk a little bit about how, you could even have this impact on mobile dentistry and, puttering around the country helping
Yeah.
people?
So, one, I think we do make that referral into all types of practices where it's in network or a patient needs physical care, right? Um,
Mm-hmm.
and then when we work with some Medicaid plans or programs that see virtual care as kind of the first step within increased access, we do end up in the spot of, okay, cool, you've now evaluated a patient and you see they need either preventive care or comprehensive care. What can you do to help increase our footprint of physical care?
Yeah.
So that's where we've partnered with Care Mobile. We've partnered with other programs, depending on where they are and what state, where we are looking to say to a plan, look, we can do a large scale outreach, give us 50,000 pediatric members.
Mm-hmm.
We can message them, engage them, understand what their needs are, see if they need to come in. And then what we want to do with Dr. Watson and other teams is then say, we're going to almost act as a logistics arm for you. We're going to help book your schedule. So when you're at this community site for 3 days, seeing a population that may not have a dentist locally or
Mm-hmm.
may not be enough Medicaid providers or members or providers accepting their plan, we're going to book your day. So it's a really productive site for you. And then other dentists, again, could help volunteer or they can help recruit. So now you're turning that into, ideally, I've talked to Kwan about it, can we get 3 hygienists and a dentist or 2? That's a significant additional resource for delivering care.
Sure.
That might be in a community site. His vans are great. So now, hey, we've got a week where we've filled up and seen a lot of patients that were not able to access care. And it's
Mm-hmm.
this nice combination of virtual visits and mobile that
Yeah.
really increase the number of access points. We've talked in some programs. Georgia has some challenging teledentistry laws, and um, we think they're changing because we look and we say there's 20 counties without a dentist. So how do you address that issue aside from we need mobile care and we need kind of virtual to be the first touch point and then really make the delivery of physical care effective without always asking, saying, hey, guess what? You're a Medicaid mom or you have
Mm,
challenges. You're going to have to drive an hour and 20 minutes to get to an office after
sure.
you waited 65, 70, 90 days to get that appointment.
Yeah.
So those are the things where we love mobile programs. We love these innovative approaches that can really help, I think, go from that first goal of I want to increase access
Mm-hmm.
in a certain level that virtual can do, and then that next level of I actually do need to deliver physical care, preventive care, comprehensive care to patients.
So it's not even the 65 plus population too. Like I'm thinking we have I'm in the Northern Virginia area. You're in a very popular, you're New York,
In
right?
New Jersey, yeah.
New Jersey. Yeah. Well, that's populated for sure. Um, there are huge just business parks, right?
Right.
And we have mobile dental vans, or we had. I mean, I haven't been out very often. I work from home now. That would just pull up and just companies would send their people down because
Right.
they didn't want to spend the time sending, taking time off and all of that. So it's not just the Medicaid or access population. I mean, this is actually a convenience that some companies like. I mean, just like bringing in the masseuse for
Right.
the chair massage. I mean, it's not much different. And I remember going, I think it was ADA one year. I went into one of these mobile vans that like, Dr. Kwan has. And I was like, this is amazing. Like, this is wild that they have. I mean, it's high tech. He's got AI hooked up in there. I mean,
Yeah.
it's just nuts. It's so cool. And I'm thinking, as much as I love my old boss, like he's now 30 minutes away. Like, just pull up outside. That would be amazing. And
Yeah.
so I think, I mean, I'm excited. It feels like as much as you've accomplished, it still feels like there's a tipping point coming.
Oh, for
For
sure.
me, yeah, that's what it feels like. But I'm unfamiliar with the legislation in Georgia. What is the issue? Like, what is it that they're?
So I think Georgia was more a letter from the board, and I think that's recently either changing or changed, where that was more of like the public health emergency is over and we're not
Um,
allowing teledentistry. But I think I heard some recent rumblings that it's changing or it has changed. Some states still see it as teledentistry is for hygiene supervision only. It's not really a
oh,
direct to patient. But I've been doing this long enough where we used to explain practice acts to people to help them understand just some levels. So
yeah,
the fact that the vast majority, I think we're at 49 states, 48 states, are really effective at allowing teledentistry. And that's why it's important for us, the way we structure Dentistry.one, to be able to respect and recognize the compliance and the patient relationship, but
hmm,
also know that we can't be the permanent dental home for that patient. There has
okay,
to be a practice. And that's where I think for any dentist listening, we want to refer patients to you. We want to make
right,
sure that one, we cast a much wider net and make that initial consult anxiety free, pain free, really judgment free, that those things that are limiters to patients coming into offices are eliminated. And then we've kind of made the concerns a little bit more manageable and understandable for patients. And then
yeah,
by kind of doing that level of concierge to say, we're going to get you into an office, they know what you need because they're able to see. So after our consult, we create an oral health report. Patient sees that. We can also share that as part of the referral. So now the
hmm,
practice knows I know how much time to slot for that. I know what's coming in. This patient is very anxious. So now we know before they come in what we need to do to make that a better experience for that patient. So I think a lot of these parts are coming together, and it's really great to see. I think the progress and kind of that early adopter starts being the new model of what can the patient experience be, what can providers do to really support that, and just
yeah.
improve care all around.
So now the risk side of it, when you were saying how much time would you need and all that, if there's a prescription that is needed, is that the Dentistry.one provider that is writing the script then? So it's not like the referring dentist accepting the patient. They don't have to worry about that part. They're coming already with the prescription, the
Right. So
antibiotics,
we
for
don't do
example.
narcotic painkiller prescriptions,
Okay.
but if they need an antibiotic or any prescription prior to that appointment, and then it's great too, because now it's a teed up appointment where you're not having someone come in and they have to come back.
Yeah,
So we've already
exactly.
done the pre medication or anything to get them in and know what's needed. So yeah, we can take care of some of that.
Okay.
And then once they're going into that office, and that's where we love it, where the practice can see we don't feel it's competitive, right? A lot of these services we can't do and we're not looking to do. We
Right.
want to make sure that patient has a regular site that they can go in for treatment. And if this becomes the opportunity where it's almost a referral from one dental practice to another dental practice,
Mm-hmm.
great, then we're doing our job. And that's where I think by working with carriers and by working with employers, we can help cast that bigger net and make the emphasis and ability to connect to preventive care much more effective so
Right.
that things aren't waiting, they're not getting postponed, it's not that higher cost procedure that people hold off on.
So is it feasible then for, say, because so many of my dental colleagues are going out of network. I mean, plenty are going in, but many are going out. But they don't want to abandon their practice, their patients. But it's kind of happening. I mean,
Mhm.
just throwing this out there, is it feasible then for that dentist to leave the network, the Delta Dental network, for example, But through Dentistry.one, just say, listen, if you do need to see me, I could at least see you on a virtual visit through this.
Mm-hmm.
And then you can decide if you want to continue with the Delta dentist, or if you want to come back and get the work done. Is that a feasible
Yeah, it
situation?
could be. It would be interesting of how, and that's where ultimately Dentistry.one, because of our experience with teledent, we still know that space of practices deploying teledentistry.
Sure.
So we still want to be in kind of, if there's a teledentistry need, we want to help you meet it. So that's
Sure.
where there's a level with Dentistry.one where we think practices will be able to use it with their own patients,
Mm-hmm.
just as the tool and the functionality. And then if they needed kind of that referral to after hours or another network of dentists, they'd be able to.
Okay.
So yeah, we're looking for kind of that patient to have a solid experience with us. And if that provider does want to make that referral, sure, that could
Okay.
happen. We also want to help that to the benefit of the patient. So if
Of
the
course.
patient, has that experience with them, great. That's, we think, beneficial to them. If they do need someone in network, then we want to help them find who's in network.
And the you mentioned a care coordinator. That's a staff member, a Dentistry.one staff member. And just real quick, what is their role in the patient journey?
Yeah, so we've made Dentistry.one pretty robust. We're almost like a full office. So we have our dentists, we have care advisors who are all licensed hygienists and really accomplished, and they're able to, by acting as a care advisor, they can see patients across all 50 states. They're
Okay.
not bound by, let's say, a state practice act for hygiene licensure. And all that expertise comes to bear in coaching and helping navigate kind of the virtual journey. And then we have care coordinators who act like care coordinators would in typical healthcare, where based on the consultation the patient had with the dentist, if they do need an appointment, our care coordinators are then going to help that patient by looking at what's covered, who's in network, what their benefits might cover. We'll
Okay.
even help them maybe try to understand what's their out of pocket going to look like if it is what the virtual evaluation may have identified. And then
Okay.
we'll do that physical, sometimes legwork. We've heard some people talk about, oh, we integrate into every practice's software. And I know enough that no practice is really letting you do that.
Yeah,
So we're
that's
going to call
the
the
last
office.
mile.
Yeah, and we're going to help them really book that appointment and make sure they get in there. And then what's nice is we maintain that touch point with ongoing education and oral health support. So you got your care you need, great. If that practice has patient education, wonderful. Keep getting it from them. But we're all going to keep, tickling you and let you know, hey, here's some helpful tips, or here's some
Yeah.
content that we think will keep you healthier.
Okay.
Yeah.
This is, I mean, I'm loving this just because I know that so many dentists want to give back, but they've got their practice they got to worry about. And so many are slowing down or just wanting to do other things. And, I hear more and more dentists saying, full time sounds great, but maybe not really full time. So this is kind of a good compromise for them. This is exciting. So, but I do, listeners, I want you to check out the Mouthwatch, the cameras too, because I have heard nothing but fantastic things about the
Thanks.
camera itself. So definitely check that out if you're looking for one. And how are they going to find you? Where do they go to find information about Dentistry.one and Mouthwatch? Same place, different places? Where do they go?
Yeah, we try to keep it confusing, but not too confusing. So if you're looking for intraoral cameras and teledent, you would go to mouthwatch.com. And Dentistry.one, which is the virtual care solution, is Dentistry.one, ONE. So that's
Okay.
our URL. You can go to Dentistry1.com too, but again, we wanted to keep it a little bit unique. And and look either way. Or if you're a provider, you can sign up to be a provider on Dentistry.one through our website. If you're a carrier and you're looking to kind of level up your virtual offerings and do a little bit more than just check a box of emergency only,
Yeah.
or if you want to just check a box, we're here for that. So we'd love to talk to you if you're a carrier and really looking at different models of engaging members and educating members and kind of improving the overall experience.
And quick question, if a provider does sign up with you, you take care of the credentialing?
Yeah, we take care of credentialing,
Okay.
enrollment. We cover the providers with malpractice coverage.
Okay.
And then there's coverage for the PC. So it's really nice and easy. We do have a long waiting list for some states because it's been pretty popular. We, have, I think, one of the larger networks within the virtual care
Mhm.
space. And we do a nice thing where I say nice thing, I think it is based on feedback from a lot of our dentists, was we didn't want to make it this round robin or like first to grab it. So someone throws a steak in the middle and 20 people and 19 people left disappointed. So we do kind of cycle patients through the providers that say they're available. They can schedule when they're available.
Okay.
And so we try to do some nice balance. We also offer CE and a lot of education and training for the providers because we know it's different. A virtual consult has some different rules around it and different expectations for patient and provider. So all of the years of experience that we have, I think really come to bear in trying to create that best screen side manner. And we're also looking to keep educating and providing CE for providers on systemic health, chronic health conditions, medical dental integration, more and more that we think is kind of our wheelhouse as a practice, in as much as we can do virtually.
This is great. This is fantastic. No, this is, as soon as you said we take care of the credentialing, I just heard a collective sigh like, okay, good. I don't have to worry about that. So I know my audience. That's the number one thing that they're probably wondering about. Should have asked it earlier. So, all right, dear listeners, I want you to check Brant's company out, and both companies, but definitely, your marching orders are next time you're in with some medical people, talk about this and how, because it's coming, the medical dental integration is coming, whether you want it or not. And let's be the ones embracing it rather than the ones being pulled kicking and screaming into it. That's always sort of been good advice that my dad's given me through the years. So thank you so much for coming on, Brant. I really appreciate it. I guess I'll see you at one of these upcoming shows and we can chat a little bit more.
Seems inevitable.
Yes, right. And dear listeners, I want to always thank you so much for taking your time and spending it with me. We'll talk to you next time.
We're all super busy, so thank you for making time for me today. The show notes will have any links that we referenced in the episode. You can also find links for my book, events, and my online insurance course, Dental Insurance Design and Management. I speak often around the country on management and insurance issues. Come hang out with me in one of my classes. I promise you'll laugh and learn.